Did you know that a balanced diet, including the mindful consumption of certain types of meat, can be a powerful ally in controlling blood sugar levels? Studies show that specific nutrients found in meats can improve insulin sensitivity and help regulate blood sugar. Curious to learn more? Then keep watching. Diet plays a crucial role in managing diabetes and preventing complications. A balanced diet helps regulate blood sugar levels, contributes to weight management, improves insulin sensitivity, and reduces the risk of cardiovascular diseases, kidney problems, and other diabetes-related complications. Many people with diabetes believe they need to avoid consuming meat. But this isn't true. The key is to prioritize the best types of meat containing certain essential nutrients, especially important if you have diabetes. Some meats are not only healthy sources of protein and healthy fats, but are also veritable goldmines of micronutrients essential for the body to function in balance. Right now, you'll discover the 5 best meat nutrients for diabetes. But first, let us know in the comments what city you're watching from so we can get to know you better. And also, hit the subscribe button to receive notifications of our videos firsthand. The first nutrient is zinc, an essential mineral with a crucial role in various bodily functions, making it even more important for people with diabetes. It acts as a conductor, orchestrating vital processes, from strengthening the immune system and wound healing to cellular metabolism and protein synthesis, the building blocks of our bodies. Meats, in general, are excellent sources of zinc, especially red meats like beef and lamb. Lean cuts are preferable, such as filet mignon, sirloin, and rump steak. Poultry, like chicken and turkey, are also good sources, particularly skinless breast. Seafood like oysters, crab, and lobster are rich in zinc, as are game meats like venison and rabbit. Studies show that zinc plays a fundamental role in improving insulin sensitivity, helping the body use it more efficiently. This is crucial for glycemic control, preventing blood sugar spikes. Furthermore, zinc helps prevent common diabetes complications, such as wound healing problems and infections. A study published in the Journal of the American College of Nutrition demonstrated that zinc supplementation improved glycemic control in patients with type 2 diabetes. Another study, published in Diabetes Care, showed that adequate zinc levels are associated with a lower risk of developing diabetic retinopathy, a complication affecting the eyes. Additionally, zinc is crucial for immune function, which can be compromised in people with diabetes, and according to a study published in the Journal of Trace Elements in Medicine and Biology, zinc supplementation improved immune function in diabetic patients. To maximize the benefits of zinc, it's ideal to prioritize lean meats prepared in healthy ways, such as grilling, baking, steaming, or stir-frying. Avoid fried foods, which add unnecessary fats to the diet. Another tip is to combine zinc-rich meats with foods rich in vitamin C, like broccoli, bell peppers, and lemons, enhancing the mineral's absorption. The recommended daily intake of zinc varies according to age and sex, but, in general, about 8 to 11 milligrams per day is recommended for adults. It's important to consult a nutritionist to determine the ideal amount for you. The bioavailability of zinc varies depending on the source. Zinc from meat is more easily absorbed by the body than zinc from plant sources. Therefore, meats are an excellent option to ensure adequate intake of this essential mineral. The second nutrient is iron, also an essential nutrient found abundantly in meats, playing a vital role in producing hemoglobin, the protein responsible for transporting oxygen throughout the body. Iron deficiency can lead to anemia, characterized by symptoms such as fatigue, weakness, shortness of breath, and pallor. Meats are excellent sources of iron, especially red meats. Beef, for example, is a rich source of heme iron, the type of iron most easily absorbed by the body. Liver, both beef and chicken, is also an excellent source of iron but should be consumed in moderation due to its high cholesterol content. Poultry, such as chicken and turkey, also contributes to iron intake, although in lesser amounts than red meats. Game meats, such as venison and wild boar, are also rich in iron. It's important to highlight the difference between heme iron, present in meats, and non-heme iron, present in vegetables. Heme iron is more easily absorbed by the body, making meats a privileged source of this nutrient. For people with diabetes, iron is an important ally in combating fatigue, a common symptom of the disease. Maintaining adequate iron levels helps improve energy, mood, and willingness to engage in daily activities. Furthermore, iron is essential for the proper functioning of the immune system, which can be compromised in individuals with diabetes. Studies have shown an association between iron deficiency and a higher risk of diabetes complications, such as neuropathy and retinopathy. Another study published in the Journal of Clinical Endocrinology and Metabolism showed that iron supplementation improved glycemic control in women with gestational diabetes. Adequate iron levels are also associated with a lower prevalence of chronic kidney disease in patients with type 2 diabetes, according to a publication in Diabetes Care. To increase the absorption of non-heme iron from other foods, combine meats with foods rich in vitamin C, such as orange juice, acerola cherries, or bell peppers. Avoid consuming coffee or tea with meals, as these beverages can interfere with iron absorption. The recommended daily intake of iron varies according to age, sex, and health status, generally being higher for women of childbearing age. It's essential to consult a nutritionist to determine the ideal amount for your specific case, especially if you have diabetes. Cooking in cast iron pans can increase the iron content of food. However, it's important to verify the origin and quality of these pans. Iron absorption can be affected by several factors, such as the presence of phytates and tannins in some foods. Therefore, it's important to have a balanced and varied diet to ensure adequate absorption of this nutrient. Third, B vitamins, a group of essential nutrients that work together to maintain proper bodily function. For people with diabetes, certain B vitamins, such as B12, B6, B1, thiamine, B2, riboflavin, B3, niacin, B5, pantothenic acid, B7, biotin, and B9, folic acid, are particularly important. Meats, in general, are good sources of B vitamins. Red meats, such as beef and lamb, are rich in vitamin B12, essential for nervous system health. Poultry, such as chicken and turkey, are also good sources of vitamin B6 and niacin. Fish, such as salmon and tuna, are rich in vitamins B12, B6, and niacin. Liver, although it should be consumed in moderation, is also an excellent source of various B vitamins. And what are the benefits of B vitamins for diabetics? Vitamin B12, essential for nervous system health, preventing diabetic neuropathy, a complication that can cause numbness, tingling, and pain in the feet and hands. B12 also contributes to red blood cell formation and proper brain function. Vitamin B6 assists in energy metabolism, converting food into energy for the body. It also plays an important role in the production of neurotransmitters, chemical substances that transmit signals between nerve cells. Vitamin B1, thiamine, fundamental for carbohydrate metabolism, helping the body convert glucose into energy. Thiamine deficiency can lead to neurological complications, especially in people with diabetes. Vitamin B2, riboflavin, important for energy production and skin and eye health. Vitamin B3, niacin, contributes to cardiovascular health, reducing the risk of heart disease, common in people with diabetes. Niacin also aids in the metabolism of carbohydrates, proteins, and fats. Vitamin B5, pantothenic acid, essential for energy metabolism and hormone production. Vitamin B7, biotin, plays an important role in the metabolism of carbohydrates, fats, and proteins. Vitamin B9, folic acid, fundamental for blood cell formation and cell growth and development. Studies show that B vitamin supplementation can be beneficial for people with diabetes. A study published in the Journal of Diabetes and its Complications showed that vitamin B1 supplementation improved nerve function in patients with diabetic neuropathy. Another study, published in the European Journal of Clinical Nutrition, indicated that supplementation with vitamins B6 and B12 reduced homocysteine levels, an amino acid associated with a higher risk of cardiovascular disease. Including lean meats, poultry, and fish in the diet regularly helps ensure adequate B vitamin intake. For diabetics, these vitamins are important allies in preventing neurological complications, increasing energy, improving mood, and maintaining cardiovascular health. Consult a nutritionist to learn the recommended daily amounts of each B vitamin for your specific case. The bioavailability of B vitamins varies depending on the source and the method of food preparation. Overcooking can reduce the content of these vitamins in meats. Therefore, choose cooking methods that preserve nutrients, such as grilling, baking, or steaming. The fourth nutrient is selenium, an essential mineral with antioxidant properties, meaning it protects the body's cells against damage caused by free radicals. Free radicals are unstable molecules that can damage cells and contribute to premature aging and the development of chronic diseases, including diabetes-related complications. Meats are good sources of selenium, especially organ meats like kidney and liver, which should be consumed in moderation despite their benefits. Red meats, such as beef and lamb, also contain selenium. Poultry, such as chicken and turkey, are considered good sources, especially dark meat. Fish, such as tuna and sardines, also provide selenium. An important detail is that the amount of selenium in meat can vary depending on the animal's diet. Animals raised on selenium-rich pastures tend to have a higher concentration of this mineral in their meat. For people with diabetes, selenium is especially important because oxidative stress, caused by excess free radicals, contributes to developing disease complications, such as kidney problems, cardiovascular issues, and neuropathy. Selenium also plays a vital role in thyroid health, which can be affected by diabetes. Studies suggest that selenium may improve insulin sensitivity and aid in glycemic control. A study published in the Journal of Trace Elements in Medicine and Biology showed that selenium supplementation improved the lipid profile and reduced oxidative stress in patients with type 2 diabetes. Another study, published in Clinical Nutrition, indicated that adequate selenium levels are associated with a lower risk of developing diabetic retinopathy. Including lean meats, poultry, and fish in your diet regularly helps ensure adequate selenium intake. The recommended daily intake of selenium varies according to age and sex, but is generally around 55 micrograms for adults. Remember to consult a nutritionist to determine the ideal amount for you and create a suitable meal plan. Selenium is better absorbed by the body when consumed together with vitamin E. Therefore, combining selenium-rich meats with vitamin E-rich foods, such as nuts and seeds, can enhance its benefits. Overcooking can reduce the selenium content in meats, so choose cooking methods that preserve nutrients, such as grilling, baking, or steaming. Finally, the fifth nutrient is magnesium, an essential mineral involved in over 300 biochemical reactions in the body, including energy production, protein synthesis, and muscle and nerve function. It also plays an essential role in regulating blood pressure, a crucial factor for people with diabetes who have a higher risk of hypertension. Although meats are not the richest sources of magnesium, they still contribute to the daily intake of this mineral. Meats in general, especially red meats, contain magnesium. Poultry, such as chicken and turkey, also provide small amounts of magnesium. Fish, such as salmon, tuna, and mackerel, are slightly better sources of magnesium compared to other meats. For people with diabetes, magnesium is particularly important as it contributes to improving insulin sensitivity and glycemic control. It also helps maintain cardiovascular health, reducing the risk of heart disease, a common complication in people with diabetes. Magnesium can also help prevent and control hypertension, another important risk factor for cardiovascular disease. Studies have shown an association between low magnesium levels and an increased risk of developing type 2 diabetes and its complications. A study published in Diabetes Care showed that magnesium supplementation improved insulin sensitivity in patients with type 2 diabetes. Another study, published in the American Journal of Clinical Nutrition, indicated that higher magnesium intake is associated with a lower risk of developing metabolic syndrome, a set of risk factors that increase the likelihood of developing type 2 diabetes and cardiovascular disease. While meats contribute to magnesium intake, it's important to include other rich sources of this mineral in the diet, such as dark leafy green vegetables, nuts, seeds, and legumes. The recommended daily intake of magnesium varies according to age and sex, generally being 310 to 420 milligrams for adults. Consult a nutritionist to determine the ideal amount, especially for people with diabetes. Magnesium is better absorbed by the body when consumed with vitamin D. Therefore, combining meat consumption with vitamin D-rich foods, such as egg yolks, or with adequate sun exposure, can enhance its benefits. Overcooking can reduce the magnesium content in meats, so always choose cooking methods that preserve nutrients, such as grilling, baking, or steaming. As we've seen, meats are essential for a balanced and healthy diet, providing nutrients that, together, balance our entire organism. Another fundamental piece in the diabetes management puzzle is regular physical activity. Exercise helps improve insulin sensitivity, controls blood sugar levels, strengthens the cardiovascular system, lowers blood pressure, aids in weight management, and promotes overall well-being. How about finding an activity you enjoy and that fits into your routine today? Whether it's walking, running, swimming, dancing, cycling, or playing a sport. Start slowly and gradually increase the intensity and duration of your workouts. Let us know in the comments if you already practice any physical activity. Maintaining a healthy lifestyle requires planning and organization, so be patient with yourself and keep going, even with small steps. Some practical tips for incorporating healthy habits into your daily life include planning your meals in advance to avoid impulsive and unhealthy choices, reading food labels to know exactly what you're consuming, controlling portion sizes to avoid excesses, and cultivating a support network with family, friends, and healthcare professionals to help you stay motivated and on the right track. Remember, small daily changes can make a big difference in your long-term health. Well-being is built into the routine. Did you like the tips? Share this video with your friends and family and help us spread important information about health and well-being. Also, subscribe to the channel so you don't miss any new videos. Remember, taking care of your health is an act of self-love. See you in the next video.